So in this video I want to give you a little bit of information on exactly what what tennis and golfer's elbow is, and really they're just umbrella terms to cover tendinopathies and tendinosis. Now I've got some muscles drawn out on my arm or highlighted on my arm, and bar two, these are muscles that are commonly going to cause that problem on the outside of your elbow or inside of your elbow that stops you from playing the sport you want to play, or stops you from doing things you want to do. Now, what is it? What's the whole reason behind it, or what causes it? So, golfer's elbow, tennis elbow are conditions that are inflammation problems. So, in this area, there's not much room for the muscles to move about or slide over each other. There's a lot of compression going on there. So, if you're not stretching after you play, they're going to cramp up potentially and lead to this issue. If they're not strong enough, that repeated resisting of stretching, so eccentric part of exercise. So in tennis or squash or badminton or table tennis, when you hit a shot backhand, you're going to hit something like this, and these muscles are going to resist that flexion. They're going to push against it because they extend the wrist. Likewise, if you're playing a forehand shot, hit the ball here or shuttlecock here, these muscles are going to resist the extension because they flex. So doing this and pushing against that ball. If there's a weakness in one of these muscles, or general fatigue, wear and tear just brings it down, then you can lead to some tendinopathies. It's an inflammation of the tendon, it's degeneration, typically due to a lack of rest, not letting it heal properly. So this can be overtraining, playing competitions, playing every day of the week, going to the gym every day of the week, just not giving your body time to heal. So I want to cover the muscles, how you can identify which one it may be, and 2 exercises which may help strengthen it and hopefully get you back to where you were before you hurt yourself. So first, a little bit of anatomy. Take 4 fingers of a hand, slap it on the outside of your other arm, and it'll roughly land on the 4 muscles of your extensors of the wrist. So all these 4 muscles, they will bring your wrist upwards. If your hand was lying flat, bringing your wrist up, all these muscles start to pop out. All 4 of them. You'll see it here clearly. 1, 2, 3, 4. So now, how do we differentiate between all these muscles and which one's causing this pain in the outside of your elbow? We start with extensor carpi radialis longus and brevis. These 2 specifically extend the wrist and abduct this, take it away from your body. So if you bring your wrist up, take it away from the body, these 2 are the primary movers in that movement. The other 2 are relatively relaxed, even though you're extending, because you're abducting it, taking it away from the body, these 2 do a lot more of the work. Extensor digitorum, this connects into the fingers, and at each level it extends it, so it'll extend it there, there and there at the very end. So if you resist this movement, then this digitorum is doing majority of the work, so we know this is the problem, if this causes that same pain. Extensor carpi ulnaris, same again, similar to these, it extends the wrist, but that's not going to pin it down exactly. So if you extend the wrist and adduct this, or bring it towards the midline of the body, then you'll see it pops out the most, more than any of the others. I'll show you here clearly, this and this. These start to calm down, this one does a lot more of the work when you bring it in. So if you bring it up, they all do the work. Bring it this way, carpi ulnaris does the work. Bring it out, brevis and longus do the work. If you bring the fingers up, digitorum does a lot more of the work. And these become more pronounced. So this is how we can differentiate between which muscle causes that pain and the outside of your elbow. So then, again, take these 4 fingers, slap them on the underside or inside of your forearm, and you'll get again 4 muscles that could also cause this pain the inside of your elbow rather than the outside. So you've got pronated teres, and all this does is rotates the arm, and you'll see if we do this or resist it, you see this bulges up more so than the rest of them, especially if you keep your hand open. So open palm, turn this over, this does all the work. Carpi palmaris, if we flex the wrist, adduct, and you'll see if you start to flex the elbow as well, this pops up more than any other muscle. If palmaris longus, make a fist, and flex, this does a lot more of the work. The palmaris means the palm, so it flexes that palm, creates that fist. If you flex, this does the majority of the job. Flex the carpi ulnaris. If we flex that wrist, adduct it, bring it towards the midline of the body, this does the majority of the work. Especially when we start to flex the elbow just a little bit, this does the majority of the job. So this is how we can differentiate between the medial muscles. But now there's two more here that could distract me as a therapist or as the patient, and thinking that these are the problems. So the thumb muscle here, when you circumduct the thumb, so move around in circles, all these pollicis muscles, they work, so they extend, they flex, they rotate, they abduct, they adduct, and they just move the thumb round and round and round. That just sits there just on the, I suppose, the end part of where the extensor muscles finish. There's a big muscle down the forearm that's not actually affecting the wrist in any way at all. It's the brachioradialis. It's sort of like a bicep muscle in that it flexes the elbow. But if we resist there, you'll see it pop up. That muscle there, this is the brachioradialis, and it has no effect over the wrist. But it comes from a similar position to where your extensors come from. So it may distract and pretend to be tennis or golfer's elbow, when in fact it's a different muscle and different problem altogether. Two exercises that you can do, variations of. To work the extensor group of muscles, you've got longus, brevis, digitorum, and ulnaris. If you want to just generally work them all, some sort of band, or if in the gym, like the cable machines, get the cable or band up to the point where when you flex that wrist, it's already in tension. So it's already tension in this band, or the weight in the cable machine is pulling it down. And then extend that wrist, bring it up as high as you can, and you'll see all these muscles start to work. If we want to work more so longus and brevis, you'd have it to the side, pull this way, and it's what we call lateral deviation. To work carpi ulnaris, similar thing, pull it the other way, there we go, pull it the other way, and be medial deviation. Again, making sure the band is tight and in the end range before going the other way. If you want to work the flexor muscles, those inside four, similar thing, band in tension, you're pulling it so the wrist is extended, and then bringing it up to. Second one is using a dumbbell. I'll start with the extensor side first. Allow your wrist to flex or drop the weight, and slowly extend, bring it up. And it's not about doing this movement, it's just about slow, controlled, slow down, slow up. Again, you can do flexors, again, up and down. So, I want to clarify a couple things in that video. And one is, when you're training any part or even rehabbing certain parts of you, you don't just want to isolate the muscles. So, I want you to have a dumbbell or use the band and grab it, because all of your wrist works together. So you may have noticed when you grab something, try it yourself, grab anything, grab your other arm, and then you feel both sides of the wrist or forearm muscles are contracting at the same time, because they're both pulling to even it out. If one side was pulling, it'd rip it apart. So when you're using the band, you grab it, you're making a fist. So everything is working in conjunction, and this is how you need to rebuild that synergy of muscles working together. This is just a general tip for any sort of rehab program you're ever going to do. And also, it may not have been clear when I was on about medial deviation bringing into to midline of the body, because of the positioning of how I had to show you. So what we always refer to the anatomical position. So if you were to stand like so, your pinky finger and on the border are close to the midline. So when we're saying adduct, so adduct to the midline of the body, it's anything this direction. When we're saying abduct, it's anything the other way. So this muscle will adduct, this muscle will abduct. Hope that's all clear.